airborne transmission of the 2019 coronavirus, COVID-19, has been demonstrated by the fact that it can remain stable in the air for up to 3 hours in confined spaces. Additionally, many common surfaces like plastic and stainless steel allow the virus to live up to 4 days, while copper surfaces only allow it to live up to 8 hours. This is a major reason why the virus has been able to claim over 40,000 lives and more than 600,000 people are battling the virus currently. Patients with the virus, shown here as a brown dot, most commonly experience fever, dry cough, difficulty breathing, runny nose, abdominal pain, and nausea. However, some patients have only experienced nausea and diarrhea. In fact, multiple studies have already demonstrated that those with mild or no symptoms routinely shed just as much of the virus. Studies demonstrate that all persons, regardless of age, sex, ethnicity, etc., are susceptible to COVID-19 infection. However, the severity of symptoms and the need for hospitalization is more likely in patients older than 70, 9.8% of whom died, those with heart disease, 10.5% of whom died, those with diabetes, of whom 7.3% have died, those with COPD, 6.3% of whom died, those with hypertension, of whom 6% have died, and those with cancer, 5.9% of whom died. Due to the fact that there are many patients currently being treated, there is no way to know the exact number of individuals who will ultimately die, and estimates of mortality varies in response to the capability of healthcare systems. Finally, just because older people are more likely to develop a severe case or die from the disease, it does not mean young people cannot die of this disease.
It's first case, and they really don't know. They are surprised. It can come out that bad so quickly, and I'm so young. I don't drink, I don't smoke.
After someone has been infected, it is important to determine not only when their treatment can be de-escalated, but also when they are no longer contagious. Therefore, to confirm if a patient has recovered, the patient must be asymptomatic while giving 2 bodily fluid samples, no less than 24 hours apart, showing no coronavirus genetic material. There are several case reports, one in preprint and others that are peer-reviewed, of a very small number of patients who tested positive again after recovery. None of them ever reinfected someone else or had shown any symptoms. More preliminary research, actually with primates, has demonstrated that after the virus is cleared, the genetic material was found in stool, although it was not infective. These results suggest that those who have been cured or beat the virus do not shed it to others, but the small number of cases are inconclusive, as these cases may be due to false negatives or positives with the current diagnostic method of RT-PCR. Additionally, there was no direct assessment of the positive retest patient's infectivity by doing viability cultures in these studies. Therefore, in China, the current policy is to keep, quote, cured individuals in quarantine, aka social distancing, for at least another 14 days after discharge. The CDC states that social distancing means staying away from gatherings of people and maintaining distance approximately 6 feet or 2 meters from others when possible. This may mean that one needs to cancel the wedding they always dreamed of, or, less dramatically, stop getting together with individuals you know are not totally socially isolated, as these practices may put many people at risk of contracting COVID-19. Additionally, monitoring your symptoms and practicing good hygiene habits such as washing your hands and covering your cough if you are sick will help to stop or slow the spread of many diseases. Social distancing makes sense for healthy individuals as well. Consider those having gone to differing environments like grocery stores, public transportation, bathrooms, restaurants, etc. It is likely that those individuals may have been exposed to COVID-19 by touching anything unsanitized, which was touched by other individuals who may have been asymptomatic but could in fact still be shedding COVID-19. In fact, the time frame from being exposed and exhibiting none to severe symptoms is at maximum 14 to 24 days. Therefore, limiting people to self-quarantine for only 14 days may still be allowing for the potential of asymptomatic spreaders to shed the disease to others. In this graphic published by the Washington Post, they demonstrate in a simulation of 100 people that viral pathogens spread much faster in a town without social isolation policies. Additionally, they model moderate distancing and demonstrate that it is not enough to decrease the strain on healthcare capacity, but that the only way to overcome the strain is to impose severe distancing policies. It is critical that society recognizes that deaths from COVID-19 can only be controlled with 2 methods, either a worldwide vaccine or by slowing down the spread of the virus. Slowing down the virus's spread is imperative because the world's healthcare systems are designed to operate near maximal volume at all times, but a sudden influx of patients can topple this mechanism. The capacity to care for patients works like this trickle of balls representing people. At any given time, based on the population that a hospital is treating, it will have varying percentages of patients with stroke, trauma, cardiac issues, respiratory, etc. These patients will be getting discharged or unfortunately passing away, while some percentage of undifferentiated patients continue to come in. The constant flow of patients is being met with a constant flow of available staff and equipment in order to continue operating without falling apart as a business. As a hospital's business structure collapses, it translates into inadequate care for patients, burning out of staff, and overwhelming the hospital's budget with overtime pay. When a pandemic hits, the use of resources like ventilators, endotracheal tubes, IV lines, N95 masks, and other personal protective equipment is often increased just to keep people from dying and keep the virus from spreading rapidly. Moreover, due to the rapid influx of patients, those in the healthcare sector end up working longer hours and some ultimately succumb to the virus. This strains the healthcare system, potentially to the point of breaking, and mortality rates become worse for everyone, not just those with the virus. Strategies to mitigate the spread and prevent the shattering of a hospital system must be employed in multiple arenas. Individually, we must learn to socially distance for a time. Governments must create boundaries for the flow of individuals while providing economic stability and ensuring supply chains. Corporations need to learn how to sanitize and implement other preventative measures. Hospitals need to be focused on preventing spread by implementing a variety of interventions, schedules with least provider overlap, personal protective equipment mandates, triage screening of patients headed to long-term care facilities, methods to segment the patient population like mobile triage instead of a waiting room, and many other measures like home testing, which is currently being piloted in London. Therefore, many governments and organizations are beginning to shut down large gatherings, and even the President of the United States has suggested that no more than 10 people be gathered at a time. Despite all of this, it has been very difficult for many people worldwide to accept the necessity of social distancing, and there have been many reports of young people having end-of-the-world get-togethers and ignoring social distancing mandates. Dr. Amin Azam, a psychiatrist in San Francisco who currently works with osmosis, notes how humans are a social species that inevitably suffer in times of isolation. He also encourages us to increase our ability to cope with this stressful time in 3 different ways. He suggests that we maximize our sense of connectedness with other individuals via technology. Another tip he mentions is recognizing one's own physical manifestations of stress and mitigating them with healthy activities like going for a short walk instead of stress eating. Finally, he suggests that love can be expressed well through words without touch. In conclusion, a government response that allows designated corporations to have access to personal protective equipment as well as other health equipment is crucial to avoid breakdown of the healthcare system. In the short term, some economic effects will be widespread and negative, but in the long run, effective resolution of this disease is more important for the health of a nation. In a January 2019 article in Nature, they reviewed multiple studies that showed the physical health of a nation overall tends to increase in an economic recession, albeit mental health in general, the health of those stricken by job loss, and the health of people in governments with less social programs had worsened. They also demonstrated that when a government invests $1 in public health during the recession, there was a $3 increase in GDP. For us in a wealthy nation, this pandemic may be the first time we will experience even the slightest pain that hits impoverished nations daily. Suddenly, safe spaces are now sites of danger. But let me remind you of the good that can come from tough times, such as numerous individuals coming together to defeat the effects of this virus.
Hey guys, Russell and Sierra here. So what we've decided to do is partner up with our local food bank in Seattle, Seattle Food Lifeline, and we're going to donate 1 million meals.
And the many efforts by ordinary citizens to continue showing how much they love the vulnerable.
The moment 4-year-old Thomas Woods opens the door.
Hey, bud, how are you?
His eyes get wide.
Let this be an encouragement in your time of solitude and a nudge to find a way to help those in need. For example, washing your hands, covering your cough, avoiding crowded places, leaving N95 masks for professionals, sharing reliable information online, bringing sanitized groceries to the vulnerable, video chatting with family, or even encouraging your company to video conference, etc.